So did you know that when patients are really empowered, it could potentially cut healthcare harm by like up to 15%? Just think about the impact of that for a second. Today, we're doing a deep dive into something really vital: patient and family engagement in healthcare. And we're focusing specifically on patient safety. You asked us to unpack this comprehensive document from the World Health Organization. It's full of global survey results, strategic goals, and some pretty compelling real world stories. Our mission here is to basically pull out the most crucial insights from your sources, give you a shortcut to understanding why you are such a vital partner in making healthcare safer for all of us.
Yeah, it's fascinating, isn't it? How often that firsthand experience,
Sure.
the patient's view or the family's view, brings safety things to light that, well, professionals might just miss otherwise.
Yeah.
It's not just about, being nice at the bedside. It's actually a pivotal strategy for improving care.
Absolutely. So let's get right to the heart of this. The WHO defines patient engagement as, let me get this right, the process of building the capacity of patients, families, carers, as well as healthcare providers to facilitate and support the active involvement of patients in their own care in order to enhance safety, quality, and people-centeredness of healthcare service delivery. What really jumps out is that this isn't just about making people feel involved, it's a real strategy to boost safety itself. Patients and families are called key partners, and their input is seen as vital for a comprehensive understanding of patient safety. And like we said at the start, studies suggest that meaningful patient engagement could potentially reduce harm by up to 15%. That's huge.
It is huge. And that potential impact is why this isn't just a suggestion, right? It's a strategic imperative.
Yep.
The WHO really underlined this by making patient and family engagement one of the 7 key objectives in their Global Patient Safety Action Plan for 2021 right through to 2030. And actually, World Patient Safety Day in 2023 was completely dedicated to this theme, engaging patients for patient safety. So it really shows that global commitment, moving beyond just talking about it to, well, urgent action.
Yeah, but despite that clear commitment, the numbers from your source show a pretty big gap. The global weighted performance score for patient engagement, it's only at 45%, and that's based on 108 countries responding. That low score isn't just a statistic, it really points to a disconnect between the strategy, the idea, and what's actually happening on the ground. It kind of suggests that just saying patient engagement is important isn't enough. The real work is in, getting rid of the barriers and changing the culture.
And that brings up a really important question, doesn't it? If so many countries are lagging, what can we learn from the ones that are doing well, especially the exceptions? What are those successful strategies that aren't just tied to how much money a country has? While places like Europe and the Americas generally score higher, and yeah, high-income countries often do better, your source points out these exceptions within lower income groups that rival or exceed the performance in higher income settings. Now, that's a powerful insight. It suggests maybe things like resourcefulness, being adaptable, community efforts. Maybe those are stronger drivers sometimes than just funding. It sort of challenges that assumption that only rich countries can lead on this.
That's a really interesting challenge. So, okay, if we're looking for solutions, where are countries actually starting to put these ideas into practice? The document lays out a few strategic areas. The first one involves getting patients involved directly in policy, program development, and even in governance structures. What really caught my eye here was the stark statistic. Only 13% of countries have appointed a patient representative to the governing board of the majority of their hospitals, just 13%. And only 1 in 5 countries around the world reported that they always involve patients in the decision-making processes related to improving the safety of healthcare. That feels like a huge gap between the goal and the reality, don't you think?
Well, absolutely. It's a massive gap. And what's interesting is, while that direct governance role is low, there is a broader recognition of patient rights happening. About 70% of countries have either developed or they're working on patient rights charters nationally. So that's more of a foundational approach, maybe. And the WHO has even launched its own patient safety rights charter. It covers 10 really crucial rights like timely care, safe practices, competent staff, and importantly, the right to patient engagement itself. It's basically saying these aren't just nice to haves, they're fundamental rights.
Right. And we do see some solid examples of countries putting this into action, like Thailand, for instance. They set up a patient safety network and actually put patient reps on their National Patient and Personnel Safety Committee. Or look at Czechia. They started a patient council back in 2017, kind of like a direct line for patients to the Ministry of Health. Cyprus even has a legal framework making sure patients are represented on all national health committees. That seems pretty forward thinking. And in the US, the President's Council of Advisors of Science and Technology recommended that patients, families, and community members should be involved in the development of all phases of patient safety planning, programming, assessment, and evaluation. So these aren't just small gestures, they're actual structural changes.
Exactly. These examples really back up that core belief from your source. Patients and their families, as well as civil society groups that represent them, are key partners in creating and executing policies and action plans for patient safety. Their unique viewpoint is just essential, really, for shaping policies that work and are truly patient-focused. Without it, you're kind of designing things in the dark.
Okay, so beyond policy, how are patients' actual lived experiences being used to improve safety day to day? Collecting feedback seems pretty common, right? 80% of countries have mechanisms in place to gather such feedback. That sounds positive, but here's the catch, and it's a big one. Only 27% of respondent countries mentioned that systems were in place to report back to patients and their families what changes had been done based on their feedback. So it seems we're pretty good at listening, but that crucial step, closing the loop, showing people their input, made a difference. That's where we often fall short.
Yeah, and that failure to follow up can really undermine trust and, make people less likely to engage next time. To get a more structured picture of patient experience, we're also seeing more use of PREMS, patient-reported experience measures, and PROMs, patient-reported outcome measures. About 1 in 5 countries said they regularly measure and collect these. Just to clarify for you listening, PREMs capture how patients perceive their care quality, like, was the communication good? Were they treated with respect? PROMs, on the other hand, measure the actual impact on health. Did their pain get better? Can they function better day to day? You really need both for a full picture of safety, going beyond just clinical observations to what the patient actually felt and experienced.
And then there's the sheer power of individual stories. Your source mentions that 21% of countries have implemented initiatives to collect and document patients' stories of harm as part of engaging patients more broadly. This is where one person's voice can really shine a light on bigger system problems. There's a particularly powerful example in the source, Susan Sheridan. She's a founding member of Patients for Patient Safety in the US. Her personal story is just, well, it's heartbreaking. Her son suffered preventable brain damage because his newborn jaundice wasn't treated properly. And then just 4 years later, her husband died at 45. Why? Because a malignant pathology report wasn't communicated, neither to his neurosurgeon nor to the family. Just imagine the strength that takes. She became, as the source says, a single mom raising a disabled son and a 4-year-old daughter, but she channeled that grief into becoming this incredible advocate. She committed herself to making healthcare safer. She learned everything she could, advocacy, diplomacy. She even co-founded a nonprofit that actually successfully changed the standard of care for jaundice management in the country. She testified before the U.S. Congress, got featured in the Wall Street Journal, USA Today, and her insights are so key. She realized that patients and family members can become effective leaders in patient safety advocacy. She really pushed for the power of partnering with policymakers, accreditors, researchers, and other patients who have suffered harm. Her motto, she says, is simple: never give up.
Susan's story is such a perfect illustration of how vital these individual narratives are. They don't just stay personal tragedies. They become catalysts for real change, informing broader policy. It truly demonstrates that lived experience, when you collect it, amplify it, give it a platform, it can be this incredibly powerful force for advocacy and reform. It turns abstract data into something deeply human, something you can't ignore.
Right. So, with stories like Susan's in mind, what's actually being done to build up this dedicated force of patient advocates? The good news, sort of, is that more than half of countries reported that their governments recognize and support the role of patient advocates and champions. That's positive recognition. However, and this is a really big however, only 12% of the countries said that they have created educational and technical resources to build the skills of patient advocates and champions and established capacity building programs targeted to them. So there's this major gap between saying advocates are important and actually giving them the tools and training they need.
That recognition to resources gap, it's a significant hurdle. The WHO has this Patients are for Patient Safety Network, the PFPS network, which is designed precisely to help bridge this gap. It offers a huge potential for global collaboration, sharing what works. But again, the numbers. Only 28% of countries reported having these PFPS networks, and most of the active ones are in high-income or upper-middle-income countries. Even more striking, only 10% actually collaborate directly with the WHO's PFPS program. So there's this massive, largely untapped potential there for global networking and building capacity much faster.
Yeah, huge potential. But despite those challenges, we do see some really promising things happening in places, like the Danish National Patient Safety Advisory Board. It started in 2015, but then it became a legal requirement in 2021, which really strengthened its role. Your source notes it emphasizes long-term relationships and trust between stakeholders. Someone involved was quoted saying, "The requirement by law is a strengthening and legitimization of a collaborative effort." And in Canada, there's Patients for Patient Safety Canada. Launched way back in 2007, it's patient-led. It has 62 members and this Patient Alliance for Patient Safety with 20 organizations, all focused on getting the public engaged for safer care. Healthcare Excellence Canada even said, "I believe that if we hadn't meaningfully involved patients, we wouldn't have generated and inspired so much innovation and improvement." So these examples really show the power of having dedicated structures and networks, even if they aren't everywhere yet. Okay, let's switch gears a bit to a really sensitive but absolutely crucial area: transparency in healthcare, especially when things go wrong. Let's start with something pretty fundamental: informed consent. Your source says more than two-thirds of the participating countries reported they have established and disseminated national guidelines on how to obtain informed consent. Hey, that seems like a pretty strong positive, right? Setting a baseline of respect and patient autonomy.
It is a good baseline. And building on that, most countries, about 80%, have set up procedures so patients like you can access your own medical records.
Sure.
That definitely helps with empowerment and health literacy, no question. But there's a big caveat here. Only 50% have taken proactive actions to inform patients about the procedures for accessing those records. So the right might exist on paper, but knowing how to actually use that right, that's still a hurdle in half the places. It's like, having a key, but not knowing which door it opens.
That's a really critical distinction. Okay, now let's tackle the really tough one: adverse event disclosure. When harm happens, your source is very clear. Patients have the right to know what happened, why it happened, how it might affect them, and what will be done to reduce any impact on their health and to prevent the incident from happening again. And they deserve an apology too. Yet this is a major area needing improvement. Only a quarter of countries have established procedures for disclosing adverse events to patients and families. Just a quarter. That's a huge shortfall in transparency right when people need it the most.
It really is. And the lack of support after these events is maybe even more concerning. Only 10%, just 1 in 10 countries, reported having guidelines for offering psychological support. And that's not just for patients and families, but also for the health workers involved, who are often deeply affected too. It raises this really profound question: how can we truly claim to care for everyone impacted by medical errors if we're not addressing the emotional and psychological fallout, which can be devastating?
Yeah, that's a tough question. But despite these wider challenges, some countries are making clear progress. Germany's 2013 Patient Rights Act, for example, specifically covers informed consent, access to records, and being told about treatment mistakes. In the UK, they have the duty of candor regulation. It's a legal requirement for providers to be open and honest about significant safety incidents, offer support, give truthful info, and apologize. And Australia has its open disclosure framework. That includes principles for communication when things go wrong, plus guidelines for psychological support. So it's clear, progress is happening, but there's still such a long way to go globally to really embed transparency and proper support when harm occurs. All right, let's pivot to our final strategic area. How are countries actually equipping you, the listener, with the knowledge you need to be an active participant in your own care? This section is all about information and education.
Yeah, and enhancing health literacy is absolutely fundamental here. The source says it allows people to become more aware of the risks and benefits of different treatments, prevent harm, and communicate better with healthcare providers. Makes sense? Now, while 66% of countries have implemented health literacy programs, which sounds good, here's a critical detail, only 19% of these programs include components specifically dedicated to raising awareness about patient safety. And perhaps even more surprising, only a small fraction of respondents, 6%, reported that skills supporting active patient involvement are taught at all levels of education, from school to university. That points to a pretty big foundational gap, doesn't it? We seem to be missing key chances to empower people as future patients right from the start.
That is a significant oversight. And speaking of information, get this: only 25% of countries make information about access, safety, and quality of health services available to the public. We're talking about things like waiting times, mortality rates, complication rates, patient satisfaction scores. This lack of public data definitely points to a need for much greater transparency so patients like you can make more informed choices about where and how you get care. Now, digital technologies, this is where things get interesting. Your source says 45% of country respondents had implemented at least one new use of digital technology to enhance patient and family involvement in patient safety. So there's clearly innovation happening. People are trying new things with tech. However, only 16% reported implementing a comprehensive strategy for use of technology for patient engagement. So again, it's lots of individual projects maybe, but often without that bigger coordinated plan behind them.
Well, the WHO MedSafe smartphone app is a really neat example of how tech can empower people right at critical moments. It came out in 2019, and it's built around the 5 moments for medication safety. It basically nudges patients and caregivers, people like you, to ask key questions, to get involved in discussions with health workers, all aimed at reducing medication errors. It's really about empowering you, the patient, to be proactive and check things in real time during your care.
That's a great practical example. And we see others too, right? Cuba apparently makes sure users of its health system get clear info through health workers, but also radio, TV, social media. Spain has this network of health schools for citizens promoting health education and self care. In Timor-Leste, there's Liga Inan. It's a mobile phone program connecting pregnant women with health pros to improve maternal and child care. Pretty cool. And Latvia has Vigo Health, a smartphone app for stroke rehab with personalized exercises and progress tracking. So these examples show innovation is definitely happening, even if those big national strategies are still developing. So as you reflect on this deep dive into your sources, it seems pretty clear. Patient engagement isn't just jargon, is it? It's a really powerful, actionable strategy, and it has proven potential to make healthcare significantly safer for all of us. We've looked at the global picture, heard incredibly inspiring stories like Susan Sheridan's, and seen some really innovative solutions popping up around the world.
Absolutely. And while we've definitely made progress in areas like, say, informed consent and gathering feedback, there are still these major gaps. Things like getting patients properly represented in governance, fully disclosing when things go wrong, providing robust psychological support. These are still big challenges. It really raises that important question for all of us involved. How can we bridge these gaps more effectively? How do we make sure every single patient feels like a genuinely vital, empowered partner in their care, not just someone things happen to?
And as you think about everything we've discussed today, maybe just mull this over, how might truly active patient engagement not just boost safety figures, but actually transform that whole patient-provider relationship? Could it foster deeper trust, maybe lead to more personalized care experiences for you and your family in the future? Something to think about. Thank you so much for joining us on this deep dive. Stay curious, stay informed, and we'll see you next time.